reflective practice has been something that's very new to me over the last couple of years, and have leaned on the guidance of doctors in this room and panelists here on the stage to really learn what that means.
Perspective of the backbone support, the oversight entity, down to a trainer, down to a director, down to the doer, the person who sees families and oversees staff. And how, regardless of which organization we're coming from, we're all focused on the same thing, which is providing the best quality services we can to our families while holding the space for our home visitors. So if it's not obvious, we're all fairly involved in home visiting, and home visiting is the work of the heart. It is not an easy thing. So there is so much that goes on. A lot of our home visitors are from the community. They're living in the same community that they're seeing families and so on and so forth. So we had to really be intentional.
See that this is the culture of our program. The way we communicate, the way we engage, the way we hold space and sit and reflect. It's really it's not a top-down experience. And I reflect back to Dr. Stroud's imagery this morning, the ladder and the wheel. We're not on ladders. We're in this wheel together with our families at the center of that wheel. And so we all have different perspectives, we all have a different way of how we're going to get there, but we're all speaking the same language. And we all have the same approach and how we're going to achieve that.
So I have a position that is very unique because I experience both worlds. I see the trainers and the coaching and reflective with Vanette, and I have a caseload, so I see clients on one-on-one. And what I do is I hold that space to empower them to see all the great things that they're doing as moms, dads, because we meet with mom, dad, sometimes grandma, whomever is involved in the family. So I get to experience this with the clients and being reflective with them and give them not the solutions, empower them to explore their own solutions because they are the experts on their family and what works for them. And also I get to use reflective with my parent coaches, which they see clients. And it's different because they come to me with the challenges they have with the clients. Sometimes they get stuck on something, they need resources. So I try also to hold that space for them.
We offer what we call labs. And labs are, when you're learning a new language or when you're taking a chemistry class, you go to the lecture portion, right? And then the real work happens in the lab when you forget how to conjugate the verb and your test tube boils over and, all of the things, right? That's what labs are. Labs are places that we practice because reflective practice, supervision, and leadership is only as good as we remember and in our bodies remember how to apply it in the moment when things get intense.